What's up, world? It's your girl Aggie, aka Nurse Ag. Welcome back or to my channel if you're new here. One of you guys asked me to talk a little bit more about what L&D nurses do in cesarean sections, and I thought a video on that alone would be quite boring. So instead, I'm here to tell you guys about the many roles L&D nurses play in addition to the obvious L&D role. So if you're interested in learning more, then please keep on watching. But first, please don't forget to thumbs up this video and subscribe to my channel. It would mean the world to me. And now let's hop in. So the first role that L&D nurses play or can play is the circulating nurse. So this is the nurse during a woman's cesarean section. Now, it's actually not very exciting, but I'm gonna give you guys the rundown. So first things first, in the C-section, you have the circulator, you have a tasker, which is kind of like your nursing tech, you have the surgical tech, the surgical assistant, and then you have the surgeon, as well as a baby team, which includes a neonatal nurse. So that's how it is at my hospital, and maybe different other places, but that's how it is where I work. The first thing is prepping your patient for the C-section. Your patient comes into the OR, you help to transfer them from the bed they're in to the OR stretcher. From there, your tasker will help you to make sure her Foley is draining, empty the Foley bag. You will clean the mom's abdomen off to make sure it's nice and sterile with either like chlorhexidine or betadine. You will make sure she's strapped into the stretcher very well so she doesn't fall down. Make sure her SCDs are on and working. And then once that's all set, you as a circulating nurse will do a timeout when everyone is in the room. The point of timeout is to make sure that everyone is on the same page as far as what's going on in the surgery. We want to make sure it's the right patient, that we're doing the right procedure, and that we all understand what the indication is. And then I'll also list off any like pertinent information, such as if she had a fever, if she has any allergies. I'll let them know that all the precautions are in place, and then I'll end the timeout by asking, do all agree? If everyone agrees, then the surgeon will commence with the surgery. So after that, you're really behind the computer as a circulating nurse, charting all the times people enter the room. You want to chart who's in the room, and then you'll eventually chart the delivery information. So once the baby comes out, you as a circulating nurse normally will call out loud or announce the time of birth of both the head and the rest of the body. The baby team will whisk away the baby to the warmer to make sure everything looks good. And the baby team is really the respiratory therapist and then a neonatal nurse. And then you as a circulating nurse are still charting, and at some point you will have to count with the surgical tech the instruments, laps, sutures, etc., to make sure everything is accounted for as the surgeon is closing up the patient. You'll do that, and then once the surgeon is done with the C-section, you will help with the dressing, like applying the dressing, and then you will do your first fundal assessment to make sure her bleeding looks good. From there, you bring in the original bed, help transfer the patient over, and then whisk her away to the recovery room. And that's about it. So I try to simplify that as much as possible. You're really just charting everything that happened, all the people that were in the room, the times people were in and out, and acting as the overhead of the surgery to make sure everything's going smoothly, that no one needs anything, and if they do, helping them with that. Sound good? Cool. The other role that L&D nurses play is the recovery nurse post cesarean section. So I've talked in previous videos about recovering our post-vaginal delivery patients. So this is very similar. The only difference I would say is that there is more attention to pain control. So they'll normally get a pain pump through their epidural, or that's connected to the epidural, or if they had to be put to sleep through general anesthesia, then they'll be connected to an IV PCA pump. But other than that, your same priorities are the pain, vital signs, and that the patient's bleeding are under control. That's about it for recovery, and they're usually down there for a little bit longer as compared to whenever they're recovering for vaginal deliveries. and the baby is also in the PACU with them, but they have the baby nurses that are admitting the baby separately. Another role that L&D nurses can play is the antepartum nurse, which I don't know if I've talked about this on my channel before, but basically it's kind of like a high risk unit we had at my hospital, where a patient, if she's antepartum, it's because she has something going on where she needs a little bit more attention. That could be like a pregnancy complication, and she might be needing medications to keep her blood pressures down and prevent seizure. She might be coming in because her water broke at an early gestation, or gestation is just another way of saying like how many weeks pregnant she is. And if that's the case, we're making sure that she is staying afebrile and that she's not getting any infection, and likely we're trying to keep her pregnant for as long as possible just so baby can grow, and perhaps giving the baby medications to mature his or her lungs in case she does deliver early. It could be someone that comes in because they got in a car accident and they need some blood work to make sure that there is nothing wrong with their placenta or with their baby. So those are some of the things the patient might be on the antepartum unit for, and that us as L&D nurses, we might turn into an antepartum nurse to make sure they are well taken care of. Moving forward, we also have the postpartum nurse, which yes, L&D nurses can also be postpartum nurses. So as a postpartum nurse, it's almost like an extension of a recovery nurse, which I think I've talked to you guys about, but you are doing a lot more education with infant safety, breastfeeding, and what to expect from their bodies as they go home and, you know, care for their little ones. For us at my hospital, the postpartum patients that I take care of are usually more high risk, so they might be getting some high alert medication after they delivered, and L&D nurses can manage those medications, or they might have had a hemorrhage and the doctor wants us to monitor them a little bit more closely. So those are the postpartum patients we tend to see. That is something else that L&D nurses do. And then finally, sometimes we are charged with actually being the midwife slash doctor. In other words, if a mom comes in and she's ready to pop out a baby, guess who's gonna catch it? Yep, me. And this has happened so many times this year, like weirdly enough, like more so than at all in my nursing career. This year, 2020, within the past 2 months, less than 2 months, I have caught more babies than I've caught in my entire career, entire nursing career. Yes, sometimes we are also the baby catcher. So because the L&D nurse can play all of these roles, it makes us quite marketable to management, because you can do so many things, but not everyone can do your job as an L&D nurse, because as an L&D nurse, we are trained to read fetal monitoring strips, to do cervical exams, to do ultrasounds, so many specific skills. So we have to do that, but then we also need to know how to take care of the antepartum patient, the postpartum patient, know how to recover and circulate cases. So that's just something to know about, that we are very skilled. That makes us very marketable to managers and when getting hired. And that is all I have for you guys. Let me know if you are L&D nurse down in the comments below and what roles I left out, because I know we do a lot and I know I probably left out a role or two. So let me know in the comments what you have to add. Also leave down any questions you have about my job, about the role of labor and delivery nurses, and I'll be more than happy to respond. I hope you all enjoyed it. I'll see you on the next one.